I wanted to get on this call to just have a chat a little bit about the event we're hosting on the 24th of Feb with you.
Yeah.
I wanted to let our patients know a little bit more about, firstly, yourself and your expertise, and also why am I even hosting an event like this? Apart from wanting to always do new things,
Yeah.
where's the link? So we'll start with yourself, a little bit of background about yourself.
Yes, perfect. So yeah, hi Davina, really looking forward to, of course, hosting the event with you coming up soon on the 24th of February. So yes, just for a little bit of background about me. So I'm Jess from Wellness by J&T. The J, of course, stands for Jess, and the T is my very good friend and business partner, Trishna. We're both experienced pharmacists with a wealth of knowledge in healthcare and holistic wellness. And I have been practicing now as a pharmacist for over a decade in various settings. So I've worked in your local sort of high street community pharmacy. I've worked in various hospitals, and I now work as a senior prescribing pharmacist in a GP practice, which I absolutely love. And I think this also leads on to Wellness by J&T and the roots of why we started this venture. Yeah, I mean, did you want me to give sort of a summary of what we do and what we offer?
Well, no, we know you. So you're a qualified pharmacist with,
Yeah.
but you prescribe, don't you, as well?
Yes, I do. Yeah, I do prescribe.
So in terms of the vitamin boosters, there are 5 that you offer. So I'll let you tell us about that. But
Yeah.
also as a summary of the benefits of each one,
Yeah.
and why a booster over taking something orally.
Okay, so yeah, I think we'll start with what we offer. So at Wellness by J&T, we offer a range of vitamin injections or boosters or shots. It's all a term for the same thing. These vitamin boosters are dedicated to supporting your health and your vitality. So these boosters, there's 5. We offer vitamin B12, vitamin D, vitamin C, biotin, and glutathione. And these are effectively injections that are administered into our muscle. So either the muscle in the upper arm, the deltoid muscle, or the muscle in the side of the hip, the gluteal muscle. And yeah, so that's sort of a summary of what we offer. And you're asking about, sorry, Davina, did you say?
Yeah, so why? So for me, personally,
Yeah.
and everybody's different.
Yeah.
I take vitamin D, for example, on a daily basis. I've explored little tablets,
Yeah.
even drops, even sprays.
Yeah.
But it's still something to do on a daily basis. So, and also as a practitioner, I
Yeah.
understand completely that compliance is everything.
Of course.
And I know that it's not always easy. So to
Yeah.
me, one of the benefits seems like, well, if I can have a booster, is it as beneficial? Is it absorbing just as well? And if it means that I only have to do it once every few months, then
Yeah.
I suppose that's a win-win for me. So
Of
yeah, a
course.
little bit on that. So is
Yeah.
the absorption just as good? And what do you find that the benefits are when it comes to compliance?
Okay, yeah, sure. Great question. It is a question that we do get asked a lot. You know, why I take this in tablet form? Why would I have a booster or an injection form of it? So I think the key one, yes, is the absorption. So vitamin injections, of course, they bypass our digestive system and our gut. So this helps to ensure that the nutrients are actually absorbed directly into our bloodstream. So that will naturally lead to better levels and actually quicker boosted levels compared to, you know, the tablet or the capsule that you might take. And generally, if we look at taking a tablet by mouth or a spray or the capsule, we will generally absorb about 10 to 40% of that dose. Whereas in injection form, we will absorb close to 100%. So you can see there sort of a huge difference. And it allows the vitamin or the, you know, the supplement to be absorbed, and actually your body can utilize it to a better extent as well. And another one you mentioned about compliance, I think, as well, that you said, and I'm always saying, you know, we have very busy lives, and it can be very difficult to remember to kind of take a vitamin or a supplement every single day. And I know, you know, personally, as much as I say it to sort of my patients that I speak to every day, my clients, I will tend to buy a vitamin or supplement, and I might take it for a week or two, and then I come to look at it again and it's in my cupboard and it's expired, or I'll take it once a week, and you're not going to be able to get the same effect than, you know, if you were to have an injection sort of in sort of a boost as a one-off. So I think it's definitely a good option for people who either forget to take tablets, maybe don't like taking them, or just would rather not for some reasons.
Yeah, that's another thing that
Yeah, for sure. And also just kind of touching on the price as well, because I think that's also important. You know, our boosters are very reasonably priced. You know, we range from £35 to £55. And I think I would say the vast majority of cases, it actually does work out much less costly than if you were to buy the equivalent dose of that supplement in tablet or capsule form and have to.
Yeah, and that absorption
Yeah,
rate, I mean, that's great, isn't it, for efficiency and efficacy? Because again, when you
absolutely.
get details of what's most efficient,
Yeah.
scientifically and medically, amazing. I didn't know that.
Yeah, of course.
And when it comes to eye health, I suppose the link here for me as well is having an expert on site would be brilliant. because increasingly so, I do find myself asking patients about what do they have as a supplement, and a lot of people do take vitamin D.
Yeah.
But I often ask them to either, if they don't take it, to start it for various eye health benefits, especially in dry eye conditions that can be chronic. Or to increase that dose. And in both of those scenarios, depending on the patient and their age, I might not feel as though I want to just say, go and buy something. And again, I'm not always aware personally of all the doses available. So I often ask them to go and speak to their pharmacist, consult with their vets that they're already on, and get that advice, and what is the dose they can have. So again, you'll be able to do that for people that are interested to support their eye health.
Yeah, and there's a lot, I mentioned before, but there's a huge amount of information out there, and a lot of misinformation as well. And I think we want to, part of the reason why we set up, Wellness by J&T is so we can help people make sense of that information by sort of understanding their goals when it comes to optimizing their health, and the ability to be able to, with our experience, provide that reliable, advice and information to them, and empower them really to sort of make those informed decisions around their healthcare. And I think what leads quite nicely to that is that we, as part of the service that we offer with the vitamin boosters, we do provide a complimentary 15-minute consultation where we will confirm, your medical history, any medicines that you might take, whether they are prescribed or over the counter, and also any supplements or vitamins that you currently take or are interested in taking in the future. And it's just so we can, of course, guide you and answer questions that you might have, but we can also ensure that that booster that you might have wanted is actually the right one for you to have, and of course that it's actually safe for you to have as well.
Perfect. Yeah, you're right in terms of knowing who to go to ask those questions. Me, and in our practice we support being specialists, and having you on site feeds into those values to be able to have that quality reassurance of what the advice is that you're getting comes from a wealth of knowledge and experience. We have so much data these days we can access, personal data about so many different things. What to do with that information is where I believe an expert has to come in to be able to give the right guidance on a personal basis. So that'll be brilliant.
And that was I was just going to say, touching on that, there is a huge, and I think it also leads into why there is so much information, is that there's a huge shift now in sort of treating sort of illnesses and health problems versus actually wanting to keep ourselves well and optimizing our health. And again, as I mentioned, making sense of that is very difficult. So I think it's going to the right people to be able to support you on your journey, because it's individual, to everyone, isn't it? I know, Davina, you were kind of interested yourself in maybe having one or two, weren't you?
Yeah, so the ones I'll be talking to you about when you're here are the B12 and vitamin D. B12 I have had before. Vitamin D I take as a medication orally daily, so it would be great to, again, have it once and then have it later and not really have to think about it.
Exactly.
That really speaks to me, and I know that I've then complied with my dosage. But glutathione is one that, again, in my journey, supporting hormones and the other benefits that it says that it has, I hadn't heard about it a lot before, but when I saw the benefits, I thought, well, actually that sounds like a really good idea. So again, for me, if it's something that you would say is something relevant and that would recommend, I'll be looking to have that.
Yeah, for sure. So I think you mentioned that you've had B12 before as well, and I think that is actually a very popular one. Even personally for me, I have a sort of booster every 2 to 3 months, and it's a very good option for helping to boost your energy levels, reducing fatigue, and for me it does help a lot with sort of your sleep pattern as well. So that's always great. We've got the vitamin D that you mentioned, which is great. I'd recommend probably having one every 6 months, which again prevents the need from you having to take your tablet every day that you might have at home. And that's very good as naturally as we get older, it's our bones, isn't it? It helps to sort of strengthen your bones and keep your bones and your teeth healthy. And of course, it's a very good option to sort of boost your immunity as well and sort of fight off bugs. So it's a great option for your immunity as well. You mentioned glutathione. So you've not had glutathione before? No. So it's often, it's basically an antioxidant that is present in all of our cells. Naturally, as we age, our levels of glutathione in the body actually decrease. And glutathione is very important for mopping up what we call free radicals in the body, which are basically unstable molecules, if you like, that can go around wreaking havoc in the body and potentially damaging sort of our cells and our tissues and contributing to sort of inflammation in the body as well. So they have antioxidant, anti-inflammatory effects, which are very beneficial. And they are also helpful in boosting our skin health as well, and helping to sort of turn over dead skin cells and brightening the skin as well. So so it's a great option for lots of different reasons.
No, that's great. Well, I talk a lot about antioxidants for the same reason, free radicals in the eye health, macular degeneration. Now those are specific to eye health where we need carotenoids, but the process is the same. So boosting antioxidant levels is obviously beneficial, especially in the aging body. It happens to the best of us.
Yeah, for sure. Yeah, definitely.
Well, no, it'd be great to see you, and thank you
Yeah,
for your time.
you're
We look forward
welcome.
to having you at the practice on the 24th of Feb and getting our boosters as well as
Yeah, for
everybody
sure.
else's.
Yeah, definitely. Really looking forward to it and can't wait. I'll see you on Monday, the 24th of February.
Yeah, take care.
Take care. Bye.